Today's topic is terminology of urinary system. These are the terms which we are going to discuss today. First, dysuria. It means painful or difficult urination. And the second one, anuria. Anuria means absence of urine production. And third one, hematuria. It means presence of blood in the urine. And fourth one, polyuria. Polyuria means abnormally excessive urination. And next one, oligouria. It means reduced urine output. Sixth one, nocturia. It means excessive urination at night. And the next one, incontinence. It means inability to control urination. And the next one, uremia. Uremia means accumulation of waste products in the blood due to kidney failure. And the next one, proteinuria. What does it mean? It means presence of excess protein in the blood. Next one, pyuria. It means presence of pus or WBCs in the urine indicating infection. And the next one, urolithiasis. It means formation of urinary stones or calculi. And the next one, cystitis. Cystitis means inflammation of the bladder, often due to infection. And the next one, renal failure. It means loss of kidney function, which can be acute or chronic. And the next one, 14th, nephritis. Nephritis means inflammation of the kidneys. And the next, glomerulonephritis. It means inflammation of the glomeruli of the kidney. And the 16th one, pyelonephritis. It means infection of the kidney. 17th one, nephrology. Nephrology means the study of kidney and its functions. Next one is kidney stone. It means a small hard mineral deposit that forms in the kidney. Next one, acute kidney injury. It means sudden loss of kidney function. And the last one, chronic kidney disease, CKD, means gradual loss of kidney function over time. Thank you. And follow Medico Flick Hub for more updates. Thank you.